know why there are so many lies about induction that spread on the internet. I know a lot of it is from birth stories, how people remember things and then they read things and they don't really understand them and they just convolute the heck out of them. So today I want to share some lies about induction that I hear a lot online. And I really want to share what the truth is, actually what studies show, so that you guys can understand how it applies to your upcoming induction. And I got to tell you, as a labor and delivery nurse, when I started in labor and delivery in 2001, there were not a whole lot of inductions. But anymore, if you go on a labor and delivery floor, there is a big number of inductions. So I'm glad that you guys are here. Even if you're not planning on an induction, I think it's smart to know a little bit about induction so that if your provider suddenly offers it, you can have some ideas for yourself. And if your provider was to offer you an induction in the office, I actually have a whole induction checklist that I recommend. I'm going to put the link down below, but it helps you go through the questions to ask your provider to know what your induction is going to look like. Because I got to say, they aren't great about doing that in the office. And I just want to tell you where I'm coming from. I've been a labor and delivery nurse for 20 years at the bedside. Plus, I had natural labor on my first baby. I was augmented on my second baby. And my third baby was a straight up induction for a baby that was never going to come. She was 12 days overdue. So I personally had these things happen to me, along with seeing thousands of patients have it happen in the hospitals. Plus, I've read a ton of studies on this. So I'm really here to give you guys some great information that you guys can trust. And you can know that it's not AI, because half the time I have like makeup on my clothes, and AI is probably not going to do that. Okay, the first myth about induction is that they hurt more. You will hear this everywhere. And I honestly think that these people are just the loudest, because when I poll people in my groups on social media, I honestly get a very 50-50 of if it hurt more or less when they're comparing labor to labor. Now, I am first here to tell you that it is very difficult to compare one labor and how you remember it to the next labor. So I want to put that out there first, but I also want to tell you that in the ARRIVE trial, which is wildly controversial, one of the things they do give the data on is they ask moms who got induced versus moms who went into labor naturally, which felt like it hurt more. And it actually was the natural labor moms who felt like it hurt more versus those who had been induced. As a labor and delivery nurse, I think pain is so subjective, and trying to compare pain versus pain, it's just hard. I will say that being induced is extremely boring. When you're at home in early labor, you can make brownies, you can watch TV, you can sleep in your own bed, which is amazing compared to hospital beds. You can be productive, or you can watch a movie on your very own TV that doesn't require a boatload of setup like the hospital. I'm just saying that when you're in early labor at home, you really can distract yourself with so many things at your own home. Versus when you come into the hospital and we start your labor for you, you are stuck in a bed. We have to have the monitors on you for an induction. And if you're looking on more information about monitoring, I'll put a post down below for you. But it's just real boring. And I gotta say, that's what I noticed with my induction. I was just like, this is really boring. I have nothing else to think about besides the pain, when I'm gonna use the restroom, and why they don't have better TV at this hospital. I mean, we brought things, we brought videos, we brought cards, I brought books, I brought games. But I was just really bored, because it's a lot of hurry up and wait with an induction, and you having to feel everything because you just can't distract yourself like you can at home. So I really think that that's one of the big ones. Now, in my Lies of Labor video, which I'll link down below, I actually talk about how oxytocin, when made in your body, is made in your brain. So it can bathe your brain with the good feelings that oxytocin normally brings. Oxytocin is the love hormone. It's what you have when you're falling in love. You'll have lots of it surrounding your baby, but it also puts you into labor. However, when we induce you, we use Pitocin, which is synthetic oxytocin, and it actually cannot reach your brain because there is a blood-brain barrier that it cannot cross. And so you don't get those early feel-good effects. Honestly, I don't know how much that matters. I think maybe in early labor it matters a little bit, but when you get into real active labor, I really do not believe the feel-good hormones are around. I personally haven't seen them as I watch patients in labor. So studies and my experience, it really just depends. That's the answer on that one. But a lot of people feel like it hurts about the same, or possibly even less, because they feel like they have a little bit more control over it. Again, varies person to person for sure. The next myth is that you cannot eat during them. So first off, in the hospital, everything runs through doctor's orders. Your doctor will provide an order that says, Nurse Hillary, I want you to induce this patient with this medication, and then call me, that kind of thing. In those orders, it may say, I do not want her to eat anything more than clear liquids. And that means that Hillary cannot provide you any food. But it really doesn't mean anything for you. Now, that doesn't mean that you should just go whole hog and eat. There may be a real reason why your provider only wants you to have clear liquids or possibly nothing. If you were to have an emergency C-section, there is a chance that you could vomit into your lungs, which would be really, really bad, which is why we try not to have people eat who are likely to have a C-section. However, just because you come in for an induction doesn't mean you're a likely candidate for a C-section, although some of you might be. So it's important to have that conversation with your provider, but if they're like, no, I don't want you to eat, no particular reason, then you can make the choice to eat on your own. And honestly, I only see the order for clear liquids or a very light diet when we're using Pitocin. Usually when you're on the earlier medications like Cytotec or misoprostol, Prostin gel or Cervidil or a Foley bulb, usually those people can eat because it's not as like high stakes as Pitocin per se. And fun fact, with some of those, you don't have to be on the monitor all the time, which can also give you an opportunity for a little bit more distraction of walking around the unit, changing position and things like that. By the way, if you have to be on the monitor, it doesn't mean that you have to stay in bed. Again, I have a whole video on monitoring that you guys should definitely check out down below because I'm a big fan of, even with wired monitoring, if they don't have wireless monitoring, still using the cords to your benefit around the bed. It still can be done. Okay, doctors sometimes make the silly mistake of saying something like, we're going to induce you at 37 weeks because baby looks small, or whatever their reasoning is. Now, why they say it like that, I have no idea. They need a marketing class because they should say, hey, I'm considering inducing you at 37 weeks. What do you think about that? So if they're the silly ones who say, I'm gonna induce you at 37 weeks, you translate that in your mind into, I'm thinking about inducing you, and the choice is always up to you. I cannot tell you how many times in my comment section I hear my provider made me get induced. And I'm here to tell you I've never seen a provider go to a patient's house, drag her out of it, bring her to the hospital. It's absolutely never happened. So you're saying that your provider made you, but in reality, it is up to you to make the choice. And it is up to you to ask the questions, and it's up to you to translate it into, they're offering me an induction. Is that something that I really want? Now, I am a big believer that you should have in your head what you would like at a perfect birth. I'm a huge fan of going through a birth plan just to think about these things when everything's calm and what you would like, because there are people out there who would love an induction. They love the medical nature of it, how controlled it is and things like that. And then there are people out there who absolutely do not want an induction. And so I think it's great to think about which of those two people are you. I have a whole free birth plan series that I'm going to link to down below that can help you go through that. Induction is one of the things on there, and I think you guys are going to find it super helpful. By the way, learning to manage hospital birth and the system is an important part of taking a birth class. The birth class that I recommend actually has a whole section on induction, so what happens at induction, and it also talks a lot about making choices that are right for you in labor and delivery. I'm going to link that class down below. And as a pro tip, there is a lot of gray area in labor and delivery. I think a lot of times people think, oh, my doctor thinks I should have an induction for high blood pressure or something like that. But there is a whole scale of high blood pressure, and we don't know where you are going to fall on it. And it's important to get that information from your provider where they're like, it's a little high, we might be able to wait, or it's really high and I'm afraid that you're going to have a stroke. Like, those are two very different things, but to you, they may just say you have high blood pressure. So again, ask more questions, manage your induction yourself. When you're talking with your provider about it, you're going to want to talk about the risks. Now, providers are not great at saying all of the risks. The main risk for an induction is that it's a really long time and it's a really boring time. Could possible complications with the baby, possible hemorrhage. So they should be talking through all those different things. And of course, there's complications that could be just for you. Hillary's just naming some of the basic ones. What is the benefit of the induction? And normally they are really highlighting the benefit of the induction, which is getting the baby out and you not being pregnant anymore, right? If they're offering an induction, they believe that baby or you would be safer if baby is outside the womb. And finally, what are the alternatives? That may be an alternative method of inducing you, like a Foley bulb versus going straight to Pitocin, or it could be waiting. Waiting is often the alternative for things in the hospital. And again, you're going to want to ask your provider, balancing what you want and what they want to make the best choice for you. But I would love to live in a world where No one says my provider made me get induced. I want you to be making that choice. The myth is that Pitocin is either the best or the absolute worst for induction. So we have several methods of induction. I have some videos here. I have a whole induction playlist that I'm going to link to down below. But there are several methods of inducing you, and it really depends on what your cervix is and how you're tolerating those different methods of induction about what is right for you. I have so many people say, I don't want to have any Pitocin involved in my induction, and most often Pitocin is involved, but I love to use the other things until your cervix passes about 3 centimeters. So again, talk with your provider about which of the methods they're recommending for you. Caveat, there is so much scare-tastics about Cytotec or misoprostol, but please don't listen to those. Talk with your provider. I'm actually a huge fan of it when used properly, and it can be really helpful. I actually have a whole video about Cytotec that I'm going to link to down below that might help you out. The final one is that you can pick when you want to be induced. I have so many people that are like, I'm 37 weeks, I'm absolutely miserable, I just want to be induced now. The hospital actually cannot offer you an induction until you are at least 39 weeks of pregnancy. So we have to take your dates, and after 39 weeks of pregnancy, you can make the choice. Now, it depends. Some hospitals are not allowing elective inductions until later on in pregnancy, but nationwide, we are not allowed to offer elective inductions until 39 weeks of pregnancy. So prior to that, you have to have a medical reason and talk with your provider about. What other questions do you have about induction? I would love to answer them down in the comments. Maybe I could make a part 2 of this one. Now, I gotta say, making the choice to be induced last time, I cried and cried about it, but it was actually very quick and it was really great. And I'm glad that I ended up doing it because having prodromal labor every night for a long period of time was not any fun. I actually have a whole video about my own induction and busting some of these myths based on my own experience. I'm going to link that one up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.